Welcome to Motherland Origins, where we tell honest stories of Africa. If you met a herbalist, would your reaction be respect or disregard? Trust or distrust? Calm or fear? If your reaction is short of admiration, then it is because colonialism disrupted, downgraded, and criminalized their role in Africa. Before colonial rule, herbalists were widely trusted and often the first point of care in their communities. Unfortunately, with the spread of colonization, European medicine was positioned as scientific and superior, while indigenous practices were labeled as backward or superstitious. Colonial governments often passed laws restricting or banning traditional healing practices. Herbalists could be accused of witchcraft or arrested for operating without colonial approval. Eventually, they were forced underground. This gradually led to a breakdown in knowledge transmission as herbal medicine relied heavily on oral tradition and apprenticeship. Effectively, younger generations were discouraged from learning traditional healing, and specialized knowledge about plants and treatments were lost. The once coherent medical systems became fragmented over time. Some knowledge simply disappeared or became incomplete. In many societies, healing was not just physical, it was tied to identity, spirituality, and community balance. Colonial influence, especially through missionary activity, discouraged or condemned these frameworks. The result was herbal practices losing their philosophical context, healing becoming more fragmented, and a decline in cultural confidence in indigenous medical systems. But beyond the herbalists who primarily administered healthcare, what did medicine in pre-colonial Africa look like? Medicine in pre-colonial Africa was not a single system, but a rich tapestry of knowledge shaped by environment, spirituality, and empirical observation. Across regions, from the Nile Valley to the forests of West Africa and the Great Lakes, healing combined practical medical skill with philosophical understandings of the body, community, and the natural world. In places like ancient Egypt, texts such as the Ebers Papyrus documented hundreds of treatments, diagnoses, and surgical procedures, and physicians practiced specialization, meaning they were doctors for the eyes, teeth, and digestive system. This was an anticipation of modern medical fields which exist today. In West Africa, systems such as Yoruba medicine emphasized diagnosis through observation, divination, and pharmacology using herbs. Similarly, the Igbo traditional medicine and healing traditions of the Kingdom of Congo relied on deep botanical knowledge, preventative care, and community-centered healing. Across East Africa and the Great Lakes region, practitioners used plant-based remedies and had strong traditions of bone setting, midwifery, and mental health care, often integrating social and spiritual restoration. These formed some of the foundations of modern medical knowledge. Now, if you're thinking medicine in pre-colonial Africa ended with the use of herbs, you're dead wrong. Some advanced procedures at the time included successful trepanation, which was drilling into the skull, treatment of fractures with splints, and wound suturing in Nubia and Egypt, backed by surgical instruments found in archaeological sites. Successful cesarean sections from the 19th century Kingdom of Bunyoro in present-day Uganda were also carried out by indigenous surgeons, using banana wine as an antiseptic and anesthesia. Successful outcomes of this procedure were rare in Europe at the time. In West Africa, inoculation practices were also carried out in the form of variolation to prevent smallpox. This influenced global medicine when it was passed on through enslaved Africans in the Americas to become what is now known as vaccination. In addition, dental and cosmetic procedures were carried out, as tooth extraction, filing, and even prosthetic replacements were practiced in some societies, alongside dermatological treatments using plant compounds. Pharmacology as an aspect of medicine in pre-colonial Africa was also quite advanced and was reflected through an extensive herbal knowledge across the continent. Plants with antimicrobial, anti-inflammatory, and analgesic properties were commonly used correctly. In fact, many modern drugs trace conceptual or chemical roots to such traditional remedies, and studies on some of these herbs are ongoing till date. Some of such herbs include African wormwood, used to treat fever, coughs, malaria-like illnesses, and respiratory infections. Bitter leaf, used to treat malaria, diabetes, and gastrointestinal issues. Cryptolepis, used to treat malaria. African peach, used to treat fever, pain, and digestive disorders. Alconia cordifolia, used to treat wounds, infections, and inflammations. The manner in which herbs were used showed that pre-colonial African medicine was not guesswork, but was based on real pharmacological effects, many now measurable in labs. Despite the wonders listed above, the emphasis on holistic care, which meant treating the physical body alongside emotional, spiritual, and communal well-being, continues to fascinate. Illness could be understood as imbalance, whether biological or social. Preventative medicine, which included diet, hygiene, ritual cleansing, and community harmony, was central to the practice of medicine at the time. It is unfortunate that the development of what could be considered one of the most advanced medical practices at the time was severely disrupted through colonialism. The notion that Western medicine was superior during this period is false, as medieval European treatments were mostly based on incorrect theories, religious and symbolic reasoning, and limited anatomical knowledge. Some bizarre medical practices in Europe at the time, which evidenced the backwardness of the field, include corpse medicine, where parts of the human body was used as treatment. With this treatment, patients could be made to consume powdered skulls, human fat, and even human blood as medicine. There was also animal therapy, where animal dung was applied to wounds, dead animals were applied to body parts, and crushed insects and animal organs were ingested. Astrological medicine, where physicians consulted the stars before treatment by timing surgeries based on zodiac signs and avoiding treating certain body parts when ruled by specific constellations, was also a thing in medieval Europe. In comparison, African medicine at the time relied on more scientific methods and was more evidence-based, while Western medicine was more belief-based. Pre-colonial African medicine was neither static nor simplistic. It was dynamic, experimental, and deeply rooted in both observation and philosophy. While not all practices meet modern scientific standards, many offer valuable insights into holistic care, preventive health, and sustainable pharmacology. The challenge today is not to romanticize the past, but to critically recover and responsibly integrate what works into a more inclusive and effective global medical system. As it stands, over 500 African plant species have been tested for medicinal properties. Many show moderate to strong activity against diseases like malaria and infections. However, only a tiny fraction have been developed into formal drugs. Indeed, there is still so much room for African contribution to the modern medicine on the global stage. But how exactly do we get there? Steps in the right direction could include scientific validation of herbal medicine, where governments and research institutions invest in studying traditional remedies to determine efficacy, dosage, and safety, thereby bridging indigenous knowledge with modern pharmacology. Policy and legal recognition, which would mean licensing and regulating traditional practitioners, could help standardize care while preserving knowledge systems. Exploring collaborative healthcare models by integrating trained herbalists and traditional healers into primary healthcare systems, especially in rural areas, would improve access and cultural relevance. Also, recording oral knowledge and incorporating it into curricula without exploiting communities would ensure preservation and respect. Encouraging ethical partnerships would also ensure that any commercialization of traditional knowledge includes fair compensation and consent from the communities that developed it. While Africa still reels from the effects of colonialism on traditional medicine, hope is not lost. By reintegrating valuable aspects of pre-colonial African medicine into modern healthcare through careful evidence-based approaches, we could eventually gain recognition for our contributions to global healthcare, while the African population also gains access to a healthcare system that works and caters to its needs. If you enjoyed this episode of Motherland Origins, make sure to like and share our videos while subscribing to our various social media platforms. Thank you for watching. See you soon.